you ever noticed bumps or lumps forming under your skin where you regularly inject insulin? If so, you're not alone. Many people who use insulin injections experience these changes, and it can be both confusing and concerning. Today, we're diving into why these lumps happen, what they mean for your diabetes management, and most importantly, what you can do to prevent and treat them. Let's start by understanding what's really going on beneath the surface. These bumps are commonly known as lipohypertrophy. It's a medical term for the thickened or lumpy areas that can develop when insulin is injected into the same spot repeatedly. You might feel a patch of skin that's harder or different from the surrounding area. While it might seem like a minor issue, these lumps are more than just a cosmetic concern. They can actually affect how your body absorbs insulin, which can impact your blood glucose control. So why do these lumps form in the first place? When you inject insulin into the same small area over and over, the tissue underneath your skin can start to change. The repeated trauma from the needle and the presence of insulin itself can cause the fat tissue to thicken and become lumpy. Over time, this area may feel firmer or even look swollen compared to the rest of your skin. It's your body's response to repeated injections in one spot. It's easy to think that these lumps are just a minor inconvenience, but they can actually make managing your diabetes much harder. When insulin is injected into a lumpy area, it may not be absorbed at the same rate every time. This means your blood glucose levels can become unpredictable even if you're using the same dose. That's why it's so important to pay attention to where you inject, not just how much insulin you use. Imagine giving yourself the same amount of insulin every day, but your blood sugar readings are all over the place. That's what can happen if insulin isn't absorbed consistently due to lipohypertrophy. You might see unexpected highs or lows, making it harder to keep your diabetes under control. This unpredictability can be frustrating, but understanding the cause is the first step to fixing it. So how can you prevent these lumps from forming? The answer is simple but powerful: rotate your injection sites. By moving your injections around, you give each area time to heal and reduce the risk of tissue changes. This helps keep your skin healthy and ensures your insulin is absorbed more predictably. It's a small change in routine that can make a big difference in your diabetes management. You might be wondering where else you can inject insulin. Common sites include your abdomen, thighs, buttocks, and sometimes your upper arms. It's important to use areas recommended by your healthcare professional and to move around within each area. Don't keep injecting into the exact same spot. Spread out your injections to keep your skin healthy. Rotating your injection sites doesn't have to be complicated. You can create a simple schedule or use a chart to track where you've injected each time. Some people divide their abdomen into sections and rotate through them, while others alternate between different body parts. The key is to avoid injecting into the same exact spot repeatedly. Another important tip is to always use a new needle for every injection. Reusing needles can damage your skin and increase the risk of lumps forming. Fresh needles are sharper and cause less trauma, helping to keep your injection sites healthy. It's a simple habit that can make a big difference. If you've already noticed a lump or hard area, don't panic. The first thing to do is stop injecting insulin into that spot. Choose a healthy, normal-feeling area instead. Over time, the affected tissue can heal and return to normal, but it may take several weeks. Patience is key, and your skin will thank you for the break. Sometimes, it's hard to tell if a lump is from insulin injections or something else. If you're unsure, don't hesitate to ask your doctor or diabetes care team to take a look. They can examine the area and give you the best advice for your situation. It's always better to be safe and get a professional opinion. It's important to remember that healing from lipohypertrophy isn't instant. The tissue may take several weeks to return to normal, especially if the area has been used for injections for a long time. Be patient and continue rotating your sites while the lump heals. Over time, you'll notice improvements in both your skin and your blood glucose control. Making small adjustments to your injection technique can have a big impact on your diabetes management. Rotating sites, using new needles, and avoiding lumpy areas all help your insulin work as intended. These simple habits can lead to more stable blood glucose levels and healthier skin. Let's recap the essentials. Insulin lumps or lipohypertrophy form when injections are given in the same spot repeatedly. They can affect insulin absorption and make blood glucose control unpredictable. The best prevention is to rotate your injection sites and use a new needle each time. If you already have a lump, avoid injecting there and give your skin time to heal. And always reach out to your healthcare team if you have concerns. Remember, the way you inject insulin matters just as much as the dose you use. By making thoughtful choices about your injection technique, you can improve your blood glucose control and protect your skin. Small steps like rotating sites and using fresh needles can make a world of difference in your daily diabetes care. Take charge of your routine and give yourself the best chance for success.